Hi, I'm Dr. Blair Masters, and I wanted to explain to you the reason why I recommend omega-3 supplements for all of my patients. For the purposes of talking about this, there's basically two kinds of fats that we consume in our diet. And there's others, but these are the ones that are important for this discussion. There's omega-3s, and a lot of people have heard of these. These come from fish oil, and there's a couple other sources, though, that people sometimes aren't aware of. If you eat grass-fed beef, or you eat a deer that's been eating grass all year or something like that, you'll get a nice ratio of omega-3s in your diet as well. Fish is probably the best source, though. For the other fat that I want to talk about is omega-6s. Omega-6s come from grains. They come from like corn oil, sunflower oil, safflower, soybean oil, a whole range of oils that come from grains. Now, the normal ratio of this is you should have 1 omega-3 to about 3 omega-6s. That's a healthy range and is good for the body. The problem is when you get too many omega-6s, and considering how many grains we eat in our diets on a regular basis, this can be a really large problem. Because when you have an overabundance of omega-6s, it goes through a couple of chemical processes and turns into what's called arachidonic acid. Arachidonic acid causes inflammation all by itself, but when there's even more of this, there's a couple more steps, and it turns into what's called prostaglandin E2. Prostaglandin E2 is a chemical that is very harmful to the body. It can cause inflammation. It can cause problems with degenerative joint disease, with heart disease, with Alzheimer's. It's been linked to cancer. As a matter of fact, some studies show this is the #1 cause of pain in America today, and also the #1 cause of cancer in America today, depending on the research that you're reading. But the problem is that the average American has approximately 1 omega-3 for about every 24 omega-6s. So there's a huge abundance of this in our diet. It's in all the pasta that you eat, it's in any fried food that you eat, because fried food is particularly bad. It's breaded, but it's also cooked in an omega-6 oil. We need to get our ratios back to a 1 to 3 to be healthy. So I recommend for someone that doesn't have any problems whatsoever, approximately 4,000 milligrams a day of omega-3s. If you have problems like chronic pain, diabetes, chronic inflammation in the body, I recommend up to, depending on the patient, 10,000 milligrams a day. Now, some people say, well, I'll just eat more fish, and that's fine. Just be sure you're eating ocean caught and not farm raised. Because what do they do with the farm raised fish? What do they feed it? What they do is they contain it, and then they feed it like corn pellets or soybean meal and that sort of thing. So it has more of this in it than it has this in it. So it's not a good thing. So I recommend people take at least 4,000 milligrams of omega-3s per day.